Hello, my name is Trina Ganguly, and the date today is June 3rd, 2023. Today I'll be presenting on the disease glaucoma. Glaucoma is a group of eye diseases characterized by damage to the optic nerve, resulting in progressive and irreversible vision loss if left untreated. It is often associated with increased intraocular pressure, which is pressure within the eye, which can lead to optic nerve damage and visual impairment. Glaucoma is a chronic and potentially sight-threatening condition that requires ongoing management and treatment. And glaucoma can be classified into several types based on different factors, such as the underlying mechanism and the anatomical features of the eye. The most common form is primary open-angle glaucoma, or POAG, which accounts for the majority of glaucoma cases. In POAG, the drainage angle of the eye gradually becomes less efficient over time, leading to a buildup of fluid and increased intraocular pressure. Another type is angle closure glaucoma, where the drainage angle becomes blocked or narrow, causing a sudden increase in intraocular pressure. Normal tension glaucoma is a variant in which optic nerve damage and visual field loss occur within normal intraocular pressure. And additionally, glaucoma can be classified as secondary when it arises as a result of other underlying conditions or factors such as trauma, inflammation, or certain medications. The exact etiology of glaucoma is not fully understood, but it is believed to involve a combination of genetic, environmental, and anatomical factors. Elevated intraocular pressure is a significant risk factor for glaucoma, as it can cause mechanical stress on the optic nerve, leading to damage over time. However, it is important to note that not all individuals with elevated intraocular pressure develop glaucoma. And conversely, glaucoma can occur in individuals with normal eye pressure. Other risk factors for glaucoma include age, especially anyone over the age of 60, family history of glaucoma, certain medical conditions such as diabetes and hypertension, certain ethnic backgrounds such as African or Asian descent, and certain structural variations in the eye's drainage system. Also, glaucoma falls under the category of optic neuropathies, which are a group of diseases that affect the optic nerve. The optic nerve is responsible for transmitting visual information from the retina to the brain. In glaucoma, the optic nerve becomes damaged, leading to progressive vision loss. Other optic nerve neuropathies include optic neuritis, ischemic optic neuropathy, and toxic optic neuropathy. Glaucoma is specifically characterized by the progressive damage to the optic nerve, often associated with increased intraocular pressure. And the clinical manifestations of glaucoma can vary depending on the type and stage of the disease. In the early stages, glaucoma is often asymptomatic, which is why regular eye exams are crucial for early detection. As the disease progresses, individuals may experience symptoms such as peripheral vision loss, blurred vision, halos around lights, difficulty adjusting to dark environments, and eventually central vision loss. In some cases, glaucoma may also present with episodes of severe eye pain, redness, headache, and nausea, particularly in angle closure glaucoma. And so it is important to note that these symptoms are not specific to glaucoma and can be present in other conditions as well. The most important diagnostic test for glaucoma is the measurement of intraocular pressure using tonometry. And this test assesses the pressure inside the eye and helps determine if it is within the normal range or elevated. Normal intraocular pressure typically ranges between 12 and 22 mmHg, but it can vary depending on factors such as age, corneal thickness, and individual variations. However, it is also important to note that elevated intraocular pressure is not always indicative of glaucoma, as some individuals with normal pressure can still develop the disease. Therefore, other tests such as a comprehensive eye exam, visual field testing, assessment of the optic nerve structure and thickness using imaging techniques like optical coherence tomography or OCT, and evaluation of the drainage angle using gonioscopy are also important when it comes to diagnosing glaucoma. These tests help evaluate the structural and functional changes associated with glaucoma and assist in determining the severity and progression of the disease. And so one differential diagnosis to consider in cases of glaucoma is optic nerve hedrution. Optic nerve hedrution are calcified deposits that accumulate in the optic nerve, which can mimic the appearance of glaucomatous optic nerve damage. These deposits can lead to optic nerve dysfunction and visual field defects, similar to glaucoma. However, unlike glaucoma, optic nerve hedrusion are typically present from a young age and may be associated with other findings such as small cups on the optic disc evaluation. And distinguishing between optic nerve hedrusion and glaucoma may require further evaluation with imaging techniques, such as a B-scan ultrasound or even a fundus autofluorescence. If glaucoma is left untreated or uncontrolled, it can lead to various complications. The most significant complication is permanent vision loss and blindness. As the disease progresses, the optic nerve damage unfortunately becomes irreversible, leading to a gradual loss of the visual field and eventually the central vision. And glaucoma can significantly impair a person's quality of life, affecting their ability to perform daily activities and tasks that require good vision. Moreover, glaucoma can also lead to secondary complications such as glaucoma-related cataracts, which are cataracts that develop due to the long-term use of glaucoma medications or increased intraocular pressure. There's also corneal damage, which includes thinning and scarring and can also occur in advanced glaucoma. Additionally, glaucoma can have emotional and psychological effects too, as individuals may experience anxiety, depression, and reduced overall well-being due to the impact on their vision and daily functioning. It is crucial for individuals with glaucoma to work closely with their eye care professionals to receive the appropriate treatment, regular monitoring, and the necessary lifestyle modifications to prevent or minimize any of the complications associated with glaucoma. And so, in conclusion, glaucoma is a group of eye diseases that are characterized by the optic nerve damage and progressive vision loss. It is classified into different types based on their various factors, such as the mechanism and anatomical features of the eye. The exact cause of glaucoma is not fully understood, but it has been understood that it involves a combination of genetic, environmental, and anatomical factors. Glaucoma falls under the category of optic neuropathies and is characterized by the progressive damage to the optic nerve, often associated with increased intraocular pressure. And clinical manifestations of glaucoma include peripheral vision, blurred vision, and eventually central vision. And the most important diagnostic test when it comes to testing for glaucoma is intraocular pressure measurement using tonometry, along with other tests that may be required to assess the optic nerve and visual field. An optic nerve hedrusion can also mimic glaucoma and should be considered in the differential diagnosis, since they do have some similar symptoms. And possible complications of glaucoma can include permanent vision loss, glaucoma-related cataracts, corneal damage, and emotional and psychological effects, such as depression and anxiety. And so a timely diagnosis, treatment, and regular monitoring are very essential and crucial when it comes to the management of glaucoma and the preventions of its complications. Thank you.